Questions about the COVID-19 vaccine from Pfizer and Moderna. LTS. In late January, the Los Angeles County Department of Public Health asked and answered questions about the Pfizer and Moderna vaccines for COVID-19. Vietnamese Daily republished the following for reference. 1. Why is vaccination important? 1 dose of Moderna's COVID-19 vaccine. Illustration, AP photo, Mary Altaffer. Immunization is a safe and effective way to prevent disease. Vaccines save millions of lives each year. When we get vaccinated, we not only protect ourselves, but also those around us. 2. How does the vaccine work? The vaccine works by preparing the body's immune system to recognize and fight off pathogens. The vaccine reduces the risk of disease by working with the body's natural defenses to create protection. Some vaccines contain a dead or weakened version of the pathogen. Others contain substances that are made to look like part of the pathogen. New mRNA vaccines, such as the COVID-19 vaccine, train the body to produce proteins that look like part of the pathogen. See the question: how does the COVID-19 vaccine work? For more information. These vaccines do not cause illness, they are used to prevent illness. When you get the shot, your immune system responds, like so. Creating antibodies. Antibodies are proteins that are naturally produced by the immune system to fight disease. Formation of immune cells in response to future infections. Remember the disease and how to fight it. If you become infected with the germ after getting the disease vaccinated, your immune system can quickly destroy it before you get sick. This is what makes vaccines effective. Instead of treating an illness after it happens, a vaccine can help keep us from getting sick in the first place. 3. How does the COVID-19 vaccine work? The 2 COVID-19 vaccines available in the United States are called mRNA vaccines. Our bodies use the messenger RNA, mRNA, to produce proteins. The mRNA in the vaccine is encased in tiny oil bubbles, also known as nanolipid or LNP particles. mRNAs enter cells and train them to produce harmless prickly protein fragments. These proteins are shaped like a part of a virus. Our immune system recognizes the presence of spiny protein fragments on the cell surface and knows that they are foreign components. Our bodies respond by inducing an immune response. It produces antibodies that can act against the prickly protein COVID-19 and form immune cells. This will protect us if we become infected with the virus in the future. 4. Can I get COVID-19 from a vaccine? Is not. After the mRNA trains the cell to produce a protein fragment, the cell breaks it down and removes it. mRNAs do not enter the cell nucleus, and mRNA vaccines do not affect or interact with our DNA strand, the structure of our genetic cells or genes, in any way. Moderna and Pfizer's COVID-19 vaccines do not contain the virus that causes COVID-19. Sometimes people have a fever or feel tired the day or more after the injection. These symptoms are normal and are a sign that the body is building immunity. You can learn more about how COVID-19 vaccine works on the Centers for Disease Control and Prevention, CDC, website. It usually takes several weeks for the body to fully develop immunity after vaccination. If a person becomes infected with the virus that causes COVID-19 just before or immediately after getting vaccinated, they can still get COVID-19. This is because the vaccine does not have enough time to provide protection. 5. Will the vaccination make me test positive for COVID-19? Is not. The vaccines will not cause your test to be as positive as the PCR test or the antigen test to the virus, such as a cotton swab test, which determines current COVID-19 infection. You may be positive for some antibody, blood, tests. This happens because one of the ways a vaccine works is by training the body to make antibodies. You should visit ph.lich.gov web link to learn more about COVID-19 tests. 6. What are the side effects of the COVID-19 vaccine? Your body may have side effects, like those from the flu shot or the shingles vaccine. Side effects are more common after the second dose, especially in young people. Side effects usually don't last long and you should feel better within a day or two. Side effects may include fever and muscle pain, headache, feeling tired, pain or redness in the arm. Side effects are normal and are signs that the vaccine is working. It shows that the body is learning to fight the pathogen and build immunity. It is important to get a second dose even if you have side effects after the first. 7. How many types of COVID-19 vaccine are available? Worldwide, more than 50 COVID-19 vaccines are being tested in humans. So far, only 2 vaccines are approved for use in the United States. The vaccines are made by Pfizer and Moderna, a COVID-19 vaccination site in Los Angeles County. Photo, Dean Musgrove, the Orange County Register via AP. 8. How many COVID-19 shots do I need? Most COVID-19 vaccines being tested have 2 doses given several weeks apart. It is important to get both doses of the same medication. The Pfizer vaccine is given in 2 doses, 21 days apart. Moderna's medication requires 2 doses, 28 days apart. If you get your second shot late, you don't have to start over. We are not sure how long the protection of the 2 doses of the vaccine will last. This also means we don't know if you will need a booster dose in the future. 9. Do I have to pay to get the COVID-19 vaccine? Is not. Your doctor or pharmacy may charge you for the cost of the shot, but the cost of the vaccine will be covered by public and private insurance companies. People without health insurance can get the COVID-19 vaccine for free. There are no direct out-of-pocket payments. 10. Am I asked about immigration status when I get COVID-19 vaccine? Is not. The COVID-19 vaccine is currently available at no cost to Los Angeles County residents, regardless of immigration status. You will not be asked about your immigration status when you get the COVID shot. Your medical information is confidential. Your doctor is not authorized to share your information with immigration agencies. 11. When can I get vaccinated? The goal is for everyone to easily get COVID-19 vaccine as soon as the bulk vaccine is available. While in stock is limited, the vaccine is currently being offered to different groups of people in different batches, or stages. You should visit vaccinalert.com for your vaccination series and when it will be available for each batch. You can also receive up-to-date information by signing up for the Los Angeles Department of Public Health's COVID-19 vaccine newsletter on this website. 12. Where can I get vaccinated when it's turn? The vaccine will be given at primary care clinic, drugstore, some workplaces. Special injection sites are run by the Public Health Department and county, city, community, and health facility partners. 13. Why do vaccines need to be taken if we can take other measures, such as keeping social distance and wearing a mask? We need to work as much as we can to prevent a pandemic. The vaccine strengthens the immune system so it is ready to fight the virus if infected. Other measures, such as wearing a mask and maintaining social distance, help reduce the risk of getting infected or spreading the virus. Together, these tools provide the best protection against COVID-19. 14. If I have been infected with COVID-19, will I need to be vaccinated again? Have. You still need to get vaccinated even if you have had COVID-19 infection. We still don't know how long you are protected after you have been exposed to COVID-19, so it is important to get vaccinated to strengthen your immunity. It is safe to get it after each COVID-19 infection, but wait after the end of your quarantine period. This is so you do not infect the healthcare provider and others when you get vaccinated. If you have been treated with monoclonal antibodies, you should wait 90 days before getting COVID-19 vaccine. 15. Can children get the COVID-19 vaccine? Is not. Children under 16 years of age cannot get the COVID-19 vaccine at this time. There is not enough information available on the use of these vaccines in children. People 16 and 17 years of age may receive the Pfizer injection. Moderna vaccine is indicated for persons 18 years of age and older. 16. Can someone with a poor immune system get the COVID-19 vaccine? Have. Current COVID-19 vaccine studies do not include people with poor immune systems, so we do not know how well the vaccine will work for these people. We know that people with poor immune systems are more likely to be infected with COVID-19 if they are exposed to the virus. If they become infected with COVID-19, they can become very sick. People in this group are advised to consult with their doctor about immunizations. Studies that include people with stable-stage HIV as well as those with metastatic cancer have found that the vaccine works as safe and effective for this group as it is for others in the studies. 17. Can allergy sufferers get COVID-19 vaccine? This depends on the type of allergy. People with allergies to things like food, animals, venom or pollen, or someone with a family history of allergies, can get the shot. But those allergic to any ingredient in the COVID-19 mRNA vaccine category or to polysorbate, emulsified liquid or oil, should not get the vaccine. People who are allergic to the shot or shot therapy for another disease should consult their doctor to decide if the shot is safe for them. Allergy information is subject to change. Be sure to check out the latest guidelines on the CDC website for COVID-19 and allergies vaccines and talk to your doctor. 18. What is the composition of the vaccine? Pfizer and Moderna's COVID-19 vaccine contains mRNA, lipids, fat, salt, sugar, and buffers. Both vaccines do not contain eggs, gelatin, rubber, or preservatives. For the complete list of vaccine ingredients, please see the recipient and caregiver vaccine information sheet. Pfizer-BioNTech COVID-19 vaccine and COVID vaccine-19 by Moderna. 19. Should I get the seasonal flu shot? The flu shot will only protect you from the flu, but at least it means you won't be at risk of getting both flu and COVID-19 at the same time. This can keep you from getting worse. Getting a flu shot now is more important than ever. If you plan to get COVID-19 vaccine soon, ask your doctor about the best time to get the flu shot. The reason is that the COVID-19 vaccine should not be given for about 2 weeks with the other vaccine. 20. What can I do now to help protect myself from COVID-19 infection until my turn to get vaccinated? To protect yourself and others, follow these tips. Wear a face mask, covering your nose and mouth when around other people. Avoid close contact with sick people. Avoid the crowd. Stay at least 6 feet away from others. Avoid a space with poor ventilation. Wash your hands often. Refer to the instructions to reduce your risk. You should do this even after getting vaccinated. 21. Can I stop wearing a veil after getting vaccinated? Is not. It is important to continue to take precautions such as washing hands, wearing a face mask, and maintaining distance, even after you have had 2 doses of the vaccine. The reason is, the COVID-19 vaccine is 95% effective. This is a really high level of protection for the vaccine, but it still means that 1 in 20 people who get the shot is unsafe. We don't know how effectively the vaccine can stop the virus from spreading. Getting vaccinated will protect you from getting sick, but you can still pass the virus on to others. It takes up to 2 weeks after the last dose to guarantee the best. If you got COVID-19 after you got the vaccine, you still need to be isolated. And if you are in close contact with someone who has a COVID, you need to be quarantined even after getting vaccinated.